All right, I see that we've got quite a few people joining. Thank you everyone for joining us today. My name is Mathieu Poirier. I'm the director of the Global Strategy Lab. I'm a York Research Chair in Global Health Equity, and I'm based at the School of Global Health at York University in Toronto, Canada. Today, the webinar is titled No Country Left Behind, Strengthening Global Tobacco Control. And we've got an amazing set of speakers, panelists. We've got a variety of topics to cover. And we're also hoping to engage all of you in the conversation. So as you join, we do encourage you to please introduce yourself in the chat. And as you listen to the conversation that's going to be unfolding and the presentations, please also add any questions that you have in the Q&A. We'll do our best to get to them at the end of today's conversation, but we'll have first a presentation and then a structured conversation with our panelists and try to get to as many questions as we can. So really, with that, I want to go right into the opening presentation and introduce our first speaker, Tina Nanyangwe-Moyo, who is an investigator with the Global Strategy Lab. She is part of our Global Legal Epidemiology Research Program and comes with expertise in advanced demographic and epidemiological research methods. With that, I will hand it over to you, Tina.
Thank you so much, Matthew, for that introduction. And hello, everyone. Thank you so much for joining us for today's webinar ahead of commemorating this year's World No Tobacco Day, themed Masking the Appeal. So I'm very happy to actually present this short presentation on behalf of the Global Strategy Lab, where we conduct transformative research to inform both the design and evaluation of global health policies. So today, I'll walk us through three key areas: the progress that we've so far made collectively in global tobacco control, the lab's contribution in that progress, and also take a deep dive into some of the critical gaps that still need attention to ensure that we get tobacco control to be very impactful for everyone. So, as many of us might be aware, significant efforts in tobacco control formally began in 2003 with the adoption of the WHO Framework Convention on Tobacco Control, or the FCTC. So since 2005, this treaty became formally binding, and today boasts over 182 ratified parties. So all these areas that you see, the grayed areas on the map. So this, the FCTC has been recognized as a landmark treaty because it reframed tobacco control, not just as a public health recommendation, but as a global legal obligation. It also established a new model for international cooperation in health. And as the first significant international treaty, this framework has been lauded by very high level figures because of its potential to significantly reduce tobacco use, but also associated health risks. And to guide countries in implementing this important treaty, the FCTC introduced the EMPA policy package. And this has measures ranging from monitoring tobacco use to raising tobacco taxes. So, but the question is, has the FCTC been effective? Literature indicates that the FCTC has really yielded some of the positive results, citing countries like the United States and Japan that have seen substantial decline in their cigarette consumption levels since the adoption of the FCTC. But we also know that this progress hasn't been even across countries or even other population groups. And as we will see, implementation is just as important as adoption. So for the Global Strategy Lab to contribute to this evidence in understanding the impact of global tobacco efforts, we have explored international cigarette consumption patterns, as you can see on the map. And you might want to know that one of the biggest challenges in tobacco control has been the lack of comparable, reliable, and openly accessible data. So before 2019, researchers have relied on proprietary data that, of course, is existing but very difficult to access, and also modeled data which lacks the required precision for evaluating policy impact. So for us to fill this gap, our team has developed the International Cigarette Consumption Database, which covers verified cigarette consumption in 71 countries, spanning 45 years. That's from 1970 to 2015. This dataset also accounts for over 95% of global cigarette consumption, and 85% of the world's population. Is really, really comprehensive. So this open data set that we have has now become a very important resource in evaluating the real-world impact of national, regional, and also global interventions around global tobacco control. It also enables us as researchers and researchers around the world to conduct more rigorous assessments of tobacco control policies. And we at the GSL have used this same data to examine the effects of the FCTC to see what real patterns have taken place since the adoption of the FCTC. And I want to share the results of this quickly. So using the in-sample focused event modeling and advanced quasi-experimental technique, we tested several factors that could be influencing the consumption trend. So, and we were actually surprised to see that our findings showed that there was no statistically significant acceleration of the tobacco control trend after the implementation of the FCTC. As you can see on the graph, but much of these details are concealed in the variations around the world, and we were quite determined to uncover this. So in the income group analysis, we see a whole different story. And once more, we were actually stunned that the 10 years following the FCTC, high-income countries and low and middle-income countries had taken divergent paths in consumption levels. And specific estimates that we uncovered showed that high-income countries had actually reduced tobacco consumption by over 1,000 cigarettes per person per year, compared to low and middle-income countries that are actually seeing an increase in their consumption levels by about 500 cigarettes per year after the FCTC. So, and even with this, we still observe that there were still some hidden patterns by region. And when we took a deep dive into looking at some of the regions, for example, we saw that a high-income country group that were represented by European region, the increase in the patterns actually showed that they reduced their consumption much more than other countries, especially compared to like low and middle income countries that were located in Asia, that actually revealed some unexpected increase compared to what we had expected. So, and to explain all this, we had we just formulated a few hypotheses. The first is that low and middle income countries hadn't been implementing the FCTC policies at the same pace as high income countries. And there are specific reasons for this. Some of them are that some countries in low and middle income countries had difficulties, or they just lacked the ability to translate the treaty into domestic law and action, and other reasons such as maybe financial capacity. The other one is the lack of strong formal implementation mechanisms, which means that countries can actually sign the treaty and also ratify it without necessarily implementing it fully, and which actually weakens and exposes vulnerable regulatory systems to tobacco company interference. Another significant reason is that globalization has also taken hold of all these dynamics that have been taking place. So rising incomes, for example, in low and middle income countries have been observed to outpace increases in cigarette consumption in cigarette prices. And this has actually made tobacco more affordable over time. And has obviously enabled more efficient tobacco trade in these regions. So this actually to us shows the challenge that the effectiveness of tobacco control is still in perils. And we also looked at another reason, for example, for this uneven progress in tobacco control policies. And the one huge hypothesis is that cigarette tax levels have been different across countries. For example, in high-income countries, as we can see on the graph, they have higher taxes. For example, as we see on the graph, over 75% of their cigarette prices are accounted for the taxes, compared to only 1% in low and low income countries. And this is a big problem. So from all this evidence, we know that the FCTC has not been working the same way in every country, and the WHO is also open-eyed about this. We also know that the tobacco use is a highly gendered behavior, but has gender been effectively integrated in tobacco control research? So this is the question that we have explored in a paper that just was published yesterday. And in this paper, we actually applied the European Institute for Gender Equality's Gender Impact Assessment Toolkit to 43 peer-reviewed studies where we examined the extent to which tobacco has been integrated in tobacco control, where gender has been integrated in tobacco control research. So what we found was that of all the 43 studies that we reviewed, 16 of those had assessed the tobacco policies that have been aligned with the FCTC, but only 5 actually comprehensively used a gender lens to evaluate the impact of tobacco control policies. And now that we understood that this gap in understanding the gender patterns in smoking behavior, we have also conducted another novel study that is currently under review in the BMJ Global Health. And right now, I'm just giving you a quick sneak peek into this upcoming study. Our team here analyzed survey data from 172 countries covering 97% of the global population to quantify gender differences in smoking intensity, which we define as the number of cigarettes consumed per day by current smokers. And our findings were quite startling. Globally, we found that men smoke 58% more cigarettes than women, and which is translated into a smoking intensity ratio of 1.58. We also observed the widest differences in smoking intensity in South Asia, where men smoked nearly 3 times more than women. And what's even more surprising is that this gap is not driven by wealth nor by gender inequities, but rather cultural and regional factors were more emerged as more predictive factors of these differences. So for us, this emphasizes the importance of tailoring tobacco control policies to local contexts. And as I close, I just want to reiterate that as we mark this year's World No Tobacco Day, we should know that tobacco control, the FCTC, one, the story of FCTC is one of both success and also unfinished business. Yes, we have seen meaningful progress so far, but too many people, especially in low and middle income countries and women across other regions of the world, are being left behind. So therefore, to enhance the collective action effort in ensuring equitable reduction in tobacco use going forward, we need first better data, disaggregated, gender sensitive, and also equity focused. We also need to focus our implementation strategies on strategies that have been seen to work. There's evidence in literature of evidence that is working somewhere else in other regions. For example, increase in tobacco tobacco taxes or cigarette taxes, but we have to ensure that this is also context specific. We should also contextualize tobacco control policies should be able to reflect local norms and behaviors, especially in some of these countries that I showed have very strong cultural factors influencing tobacco use. We should also ensure that we try by all means to close this research to policy gap. There's evidence that is being generated right now that can effectively inform tobacco control measures, but sometimes we lack this connection between research and policy, and we have to ensure that this gap is closed. And lastly, we should effectively use the tools that we have at hand. We have the evidence, we have the advocacy. We have to stop the deceptive strategies that are being used by the tobacco and nicotine industries that aim to mainly attract young people and hook a generation of users. Their efforts are usually focused on making harmful products look trendy, look harmless, and also fun. So we must unmask their appeal. Thank you so much for listening.
Thank you so much, Tina. Excellent presentation. What I'm hearing is so many ways that we need to stop leaving anyone behind, whether it's countries, whether it's people, and ensuring that everyone can have the benefits of smoke-free workplaces, homes, and lifestyles. So thank you so much. I'm going to now turn to Les Hagen. Les is the Executive Director of Action on Smoking and Health Canada and an adjunct professor of the University of Alberta School of Public Health. He's led tobacco control efforts in Canada and beyond for over 30 years, and recently has guided the launch of the Global Tobacco Control Progress Hub. So Les, through ASH Canada, you led the development of this Global Tobacco Control Progress Hub, which is the world's first open access public health treaty surveillance platform. Can you guide us through how thoroughly these empower measures are being actually implemented around the world, including between high-income countries and low and middle-income countries?
Thank you very much for inviting me, and thank you to Global Strategy Lab for all of its research, including the recent work on gender analysis and the establishment of the global consumption data set. Those are very valuable contributions. I'm just going to share my screen here. I've got a few slides to go with my answer. And I'm just encountering a technical issue here.
It's all right. We're seeing a small presentation.
You can see part of the slide?
Yes.
Okay. That should be better.
Perfect.
Okay, great. Welcome everyone. I've got a prepared answer because it's a prepared question, and I certainly welcome your questions when we close down here at the end of the webinar. ASH Canada created the Global Progress Hub in 2022 in collaboration with the Institute for Global Tobacco Control at Johns Hopkins Bloomberg School of Public Health. The hub consolidates all major tobacco control data sets I shouldn't say all. It consolidates major tobacco control data sets, including Empower, and enables users to explore a wide range of indicators and measures for 195 countries. One of the primary objectives of the Progress Hub was to track the implementation of the FCTC and Empower using several variables, including country income level. And I'm just going to advance the slide. Yeah, okay, great. Ash Canada first reported a slowdown in Empower scoring in the fall of 2023. The slowdown was the first reported since Empower was launched in 2008. The slowdown was more pronounced among low-income countries and was a barometer for things to come. The question is, has Empower implementation been slower in low-income countries? And the answer appears to be yes. Although Empower scoring has increased among low-income countries since 2010, the pace is slower than that of high-income countries or the global average. In contrast, lower middle-income countries have kept pace with the global average in high-income countries. However, it's not all bad news for low-income countries. I'll quickly break down the results for low-income countries by Empower letter, starting with M for monitor. In terms of monitor, national school-based youth tobacco surveys are much less likely to be in place in low-income countries and have steadily declined since 2010. Adult surveys are also less likely to be in place. P for protect. There has been substantial improvement in protection from secondhand smoke in low-income countries since 2010. These gains were realized in all public places and work sites. O for offer. Offer help to quit remains unchanged in overall scoring since 2010 in low-income countries and actually in all income gradients. Warn package, W. There has been a substantial increase in package warnings in low-income countries since 2010, and that trend has been similar among all income gradients. W warn mass media has fluctuated considerably since 2010, reaching a low in 2016 and a high in 2020, and then dropping in 2022 in low-income countries. However, the implementation of low-income countries has been lower than other income gradients for all reporting periods. E for enforce advertising bans, and that we're talking about bans on tobacco advertising, promotion, and sponsorship. This indicator has been affected the least by country income level, with steady and substantial improvements among all gradients since 2010, and this reflects what Tina was discussing earlier. R for raise taxes. The tobacco taxation scores have remained relatively stagnant in low-income countries since 2010, and this is contributing to lower overall Empower scores. Tobacco tax increases are the single most effective tobacco control measure, and the lack of progress in low-income countries needs to be addressed. I'll just stop the share and just have some concluding remarks. So in conclusion, Empower policy measures that fall under the jurisdiction of national health departments and do not involve tax increases or significant spending are the most likely to be adopted in low-income countries. All of these policy measures align with the FCTC Global Accelerator, and it includes secondhand smoke protection, health warnings on packages, and tobacco advertising, promotion, and sponsorship restrictions. Going forward, low-income countries should be encouraged to implement all Empower measures. Tax increases should be positioned as a means to generate revenue, including funding for smoking cessation and mass media campaigns. Future progress in improving Empower and FCTC implementation in low-income countries requires further analysis of successful low-income countries. Disadvantaged countries face numerous restrictions and hurdles, and funding organizations and NGOs should provide more targeted support to help overcome these challenges. Stakeholders should also actively identify opportunities for further gains, such as a change in leadership or governance.
All right. No, thank you so much for that excellent overview, Les, really breaking down the different factors that might be behind these differences in implementation around the world. And I actually now want to turn to Ouleymatou Diop. So Ouleymatou is the African Regional Coordinator for the Global Alliance for Tobacco Control, GATC, which is a role that she assumed after more than a decade of experience advancing global health initiatives. She has a background in project management, strategic planning, compliance, and donor engagement. So Ouleymatou, as a leading voice for civil society organizations that are advocating for strengthening and accelerating progress in implementing the FCTC, what should policymakers and researchers be prioritizing ahead of the next session of the Conference of Parties to the FCTC in November?
Thank you, Mathieu, for the question. So speaking from the perspective of the WHO Afro region, this moment ahead of COP11 is really a critical opportunity to actually reflect on what progress really looks like in low and middle income countries and how we can support a more equitable implementation moving forward. And just like Tina's presentation showcase, the reality is that while high-income countries have made huge gains, much of Africa continues to face persistent challenges, particularly from the industry interference and also under-resourced enforcement. So one area that would need our attention would be the implementation first of core FCTC articles, such as Article 5.3 on protecting health policy from tobacco industry interference, Article 6 on tobacco taxation, Article 8 on smoke-free environment, and also Article 11 on health warnings and packaging. In the Afro region, 44 out of the 47 countries are parties to the FCTC. However, none of them have fully implemented all of its provisions. The implementation rates vary significantly. For example, we have Kenya that has achieved about 75% implementation. We have Nigeria that is at about 46.6%. And then we also have countries like Ghana and Senegal that have made huge strides with the smoke-free legislations and packaging reforms, but the enforcement of those legislations often remain weak due to political and institutional capacity gaps. So setting national milestones or regional milestones, as well as timelines now, can really help translate our intent into action and sort of create a momentum ahead of COP. Another issue would be the role of civil society. So when we talk about strengthening implementation, it's not just about the technical support, it is also about participation. So ahead of COP11, there would be real value in putting mechanisms in place that would bring all the community voices into national planning, while also reinforcing engagement will help us meet the Article 5.3 goal, not only in principle, but also in practice. And of course, none of this would really happen without sustainable financing. So tobacco control efforts in the Afro region really continue to suffer from underfunding. So a 2019 analysis had showed that international donors contribute to about just 4% of the global funding that is really needed for tobacco control. Meanwhile, countries with low level of implementation, low and middle income countries, which many are in the Afro region, are meeting only also 4% of their funding needs through domestic budgets. So in contrast, countries, well, high income countries, tobacco control fund about 63% of their needs domestically. So that kind of highlights how we lack, both of them lack international support, and also insufficient prioritization. But despite all these challenges, there has been some great progress. So we have 77% of Afro member states that have enacted tobacco control laws and regulations. However, only 34% have developed and implemented multi-sectoral strategic plans that are aligned with the FCTC. And just 47% have really made policy reforms to actually improve taxation and use tools such as the WHO's taxing. So these figures actually show that while there's movement, there's also gaps that are still very wide, especially in the financing part. And also just overall coordinated strategy. So that is why it is essential for countries to prioritize domestic investment, include stronger tobacco taxes, and also target support for national focal points. And if we do want COP11 to be a really great turning point, then what happens between now and as much as what's actually decided at the event itself.
Thank you, Ouleymatou. I think I might have lost the very last part of the closing message, but we had an excellent high-level overview of what's really a mixed picture. There's a lot of implementation challenges, funding challenges, but also a good news story in that every region has some exemplars of countries that are doing excellent work in implementing tobacco control, pointing to the example of Kenya, and also the importance of involving civil society advocacy. This is not just a scientific problem, it's a political issue. And so thank you for that. And we've really been talking a lot about country level implementation and not so much about really the topic of this World No Tobacco Day, which is tobacco industry. So for that, let me turn to Jaime Arcila, who is a senior researcher and organizer at Corporate Accountability, promoting the implementation of the WHO FCTC with a focus on protecting public health policies from commercial and other vested interests of the tobacco industry. So Jaime, the theme for World No Tobacco Day this year is unmasking the appeal of tobacco and nicotine industries who are using carefully engineered products and deceptive tactics to hook a new generation of users and also keep existing ones. Can you tell us about the tactics that the tobacco industry are currently using to undermine all of these tobacco control efforts around the world?
Thank you. Thank you very much for the invitation. Yeah, there is a very extensive list of tobacco industry tactics, from advertisement, CSR, to lobby. But today I want to mention a very particular one. The industry today speaks about the language of transformation. That is innovation, harm reduction, health and wellness. And this narrative is not new. There is no new ideas about this. This is a recycled narrative used to legitimize their business around 40 years ago. And all these elements, the flavors, the products, the innovation was designed decades ago. So the tobacco industry documents show that the tobacco companies themselves, they used to see themselves as a nicotine specialist, like a pharmaceutical entities, long before they start launching the current products, the emerging products, and this PR campaign on innovation. So this health and wellness strategy is old, but they are rebranding this. What is truly concerning is less than 10 corporations dominate this global business. So it's pretty easy for them to collaborate, to brand sharing deals, joint lobbying efforts, legal strategies to mirror each other. This is less about competition. Today is much more about coordinating a global influence between them. And finally, regarding this point, I want to remember that the real business remains cigarettes. For instance, in last year, in the last report that Philip Morris presented about its best-selling global brand, Marlboro, it represents around 40% of the total cigarette volume. And 7, 8 years ago, they are saying that they want to stop selling cigarettes. But when you take a look at the numbers, you see that this business is what supports what they call transformation.
Well, that is certainly taking the mask off. If you just look at the numbers, suddenly the messaging goes away. Thank you, Jaime. I will now go around to the panelists for another round of questions. But as I do that, please do anyone who is attending, put your questions in the Q&A, and we'll try to get to as many as possible at the end of today's webinar. Let me return to Tina first and ask, so your analysis of global smoking intensity has highlighted some significant gender differences in cigarette use across countries. And we know from the publication that was actually released yesterday that this is an under-researched area in tobacco control. Can you tell us a bit more about what this means for the design of tobacco control policies and for enhancing global tobacco control?
Yeah, thank you so much, Matthew. I think for the FCDC, actually, one of the important blind spot that we have seen is this integration of gender, because if we're going to see effectiveness or progress in the way the FCDC is going to help reduce tobacco use, we have to know that everyone is going to be reached by these policies. But at the moment, I think it's far away from this point. And as the panelists have highlighted, I think it's important for us to, for example, focus on monitoring, for example, tobacco use, whether countries, for example, low and middle income countries are being compliant to the FCDC. We have to nail it down to understand or to put up systems that are going to track how tobacco use is affecting everyone. Men and women being included the same, young people or people in rural areas being affected by these policies. I think that is the most important question. And when we talk about gender disaggregation, we are not talking about just men and women. We are talking about the social factors that affect these people to make these decisions, because the decision to smoke, the decision to get into this behavior is not a rational one that is solely affected by the price or affordability of tobacco. It's also about so many other factors that are embedded in the lifestyles that people who actually make these decisions are influenced by. So when we talk about ensuring that all the policies and also the evaluations of these policies are disaggregated by gender, it's an imperative for both researchers and policymakers, and also the civil society that are advocating for the effectiveness of these policies. So I think our data really brings the evidence that we can use both as a tool and also as a framework that we can use to inform policy, but also to push that policy is implemented, because it is real evidence that is coming across. So I think besides this, I think it's very important for us to ensure that within the surveillance of how the policy is working, we embed equity audits. So I think we have the Empower policy, and we are recording and collecting data on how countries are complying to this. But we need to embed it with gender audits, equity audits within this, so that we can see that the policies are actually effective, not just for one person or for one country, but for actual people that are making this decision to smoke and to engage in this very harmful behavior. So we have to ask, who do these laws actually reach? Who do they benefit? So these questions can only be answered if research, like the one that we're conducting, the kind of research that we're conducting, can reach the tables that on which these policies are designed. And we think this data infrastructure should also make sure that this the gender aspect of the policies is implemented and integrated into this. And I think for us, this is a very important call to improving, enhancing the fight against tobacco control and the companies themselves.
Thank you again, Tina. Such an important message to leave no one behind. And to me, this is a call that really applies universally because we're not seeing enough research in any country, including high-income countries where many well-funded research institutes are based. We're not seeing this at the secretariat level enough. We need more emphasis on equity promoting measures, including a focus on gender at every level. So thank you for that. Let me turn again now to Les. Ash Canada has also recently produced a progress report on SDG Target 3A, a lot of products in the work, that reflects the FCTC implementation and was endorsed by over 50 NGOs around the world. Can you share some of the report's findings with us?
I sure can. Thank you very much. And I just got it one quick share here. And that is just to show the report itself. Great. So thank you again. And the SDG Shadow Report was one of the first deliverables that we identified in creating the Global Progress Hub a few years ago. We will formally be releasing the report tomorrow. And as you mentioned, we've had over 50 NGOs from around the world endorse this report. For some reason, the cover page isn't showing, but at least you can see the organizations that are endorsing the report, which is good. And thank you to everyone who did. Thank you very much. So the timing of the report coincides with the upcoming SDG review that will be held by the United Nations Economic and Social Council in July. And Target 3A, as many of you know, was the first target established under SDG Goal 3 in 2015, which is good health and well-being. And it speaks to the importance of the FCTC in advancing global health. The primary indicator tied to Target 3A is a 30% reduction in tobacco use prevalence among those aged 15 years and over between 2010 and 2025. The indicator can be applied to national or global levels and allows countries to monitor their overall progress and to compare their results with others. The SDG report provides a reality check on FCTC implementation and global tobacco control efforts, and there is good news and bad. Let's start with the good news. The good news is that 150 countries have experienced declines in tobacco use, and we're talking about prevalence, since 2010, with 56 of them on track to achieve the voluntary target of a 30% reduction by this year. This is no small achievement, especially considering the global instability of the past 5 years. I can also report the 2025 target is expected to be met for women, which is also no small achievement. I know this is of great interest to ASH Canada, the Global Strategy Lab, and many others working to address gender inequities in global health. Another critical point is that although tobacco control is formally aligned with the SDGs, its impact extends to all 17 SDGs due to its enormous global footprint. Now, the bad news. The major takeaway from the Target 3A report is based on current trends, the global tobacco use prevalence target is not expected to be achieved for another 4 years. This delay corresponds with an additional 95 million tobacco users who would have otherwise quit by this year. These additional smokers could lead to millions of additional premature deaths, especially if the delay is sustained. The global strategy tied to Target 3A has been extended for another 5 years to reflect this delay. In its 2023 SDG midterm report, the UN downgraded Target 3A from on track to acceleration needed. In other words, the FCTC accelerator needs to be accelerated. In fairness to the FCTC, many SDGs and their targets have been delayed or downgraded, and global instability is primarily to blame. The lingering effects of the COVID-19 pandemic, climate change, wars, and political conflict are contributing to this instability. Tobacco control is not immune to these challenges, and we should not expect the FCTC to escape unhindered. These challenges have hit low-income countries the hardest, and the FCTC implementation gap appears to be widening between high and low-income countries. Added to these challenges is the omnipresent influence of the tobacco industry and its interference with the development of tobacco control policy. Just quickly, the actions required from our report, and these are just a few of the recommendations: accelerate the implementation of the FCTC Global Accelerator, actively engage civil society in policy development. The importance of civil society is acknowledged in Article 4 of the FCTC, and civil society engagement is a cornerstone of the treaty. Focus on high-impact articles, as Tina referred to, including those that align with Empower, such as tobacco tax increases. And encourage all parties to implement Article 5.3 and its guidelines to reduce tobacco industry interference. And you'll be able to read all of our recommendations in tomorrow's report.
Right. Thanks again. We're really looking forward to the release of that report. And if you look closely, the Global Strategy Lab is one of those endorsing organizations. So let me turn again to Ouleymatou and ask, because we're talking about where can we find examples of success and even looking to other sectors. And as someone who has contributed to a wide variety of public health programs across Africa on issues like communicable diseases like HIV and malaria, are there any lessons that we can learn from those experiences to better design and implement more effective tobacco control policies in the region?
Yes, absolutely. So having worked on malaria and other non-communicable diseases, programs, there are a number of tobacco control today, particularly in the Afro region where the burden actually continues to grow and the resources remain pretty stretched. One of the most consistent lessons was the power of community engagement. So in Senegal, for example, community health workers weren't just delivering services, they were trusted and locally trained members of the gap between policy and the actual lived experience. And that same localized trust is essential for tobacco control enforcement and also messaging. Another big lesson was around financing. So many of the HIV and malaria programs in the region started with donor funding. But long-term sustainability only came when the governments actually began allocating their own resources as well, often through health levies or just earmarked budgets. So tobacco control efforts in Africa could really benefit from a similar financing model, and without it, implementation could remain fragile. And finally, we saw real success when programs were integrated into just broader health systems. For example, maternal and primary care. And I really feel like tobacco control could also benefit from following that path. Prevention and cessation services could also be embedded into everyday health delivery. There's just overall rights and dignity, and also just enmesh with local realities. So these aren't just abstract ideas, since there are lessons that have worked in our region, and if we can actually apply them intentionally to tobacco control, I believe we could make faster and a more lasting progress.
Thank you. There are quite a few lessons to be learned there. Integration, community engagement, funding, country buy-in, excellent cross-sectoral lessons. I'm going to quickly turn to our final speaker again, Jaime. You brought up some tobacco industry tactics in your first answer, but we also know that you've done work through the Corporate Accountability Project, looking at how governments might deal with corporate interference and holding the tobacco industry accountable. So what concrete steps should governments and other international organizations take to protect public health from the industry's influence?
And thank you again. I think that the first element, this is not a matter of public preference or a policy preference. I'm sorry. This is a democratic obligation under an international treaty. So governments must fully implement the FCTC, and especially the Article 5.3 and the guidelines, beyond political cycles or ideological shifts. This is very important because sometimes you have a very strong tobacco control champion. It's a government that really wants to implement the FCTC. They have the political will, and suddenly something changed. A new government arrived, and everything changed. So it's very important to implement the FCTC with the dependence of the political view of the government in charge. Second, government should move to recover the true cost of the tobacco epidemic. This is through civil and, where appropriated, criminal liability also. That means enforcing existing laws, transparency, and holding the industry accountable, not just in rhetoric, but in courtrooms and in national budgets. Like some governments are doing that right now. In Latin America, we have the case of Brazil, for example. In Africa, we have Nigeria also. So third, tobacco control itself is harm reduction, according with the FCTC. So, and the FCTC recognizes the importance of civil society in the moment to implement the FCTC, as Les mentioned. So civil society, independent from the tobacco industry narrative, no? International organizations are key on monitoring, denouncing, mobilizing, and providing technical support, research, and also the dissemination of the information. So in order to hold the industry accountable, we need to know what the industry is doing, how they are trying to interfere with the laws, and what is the behavior they have in our countries. So it's a personal invitation from Corporate Accountability to sign our petition to make big tobacco pay.
Wow, thank you for that call. And I'm going to stay on this topic and actually combine a few questions that we've gotten together and throw it out to anyone who wants to answer. There's a few questions pointing to tobacco industry narratives that are put forward. One, that they contribute a lot to national economies and that dealing with tobacco might harm national economic growth. The other is that vaping products might contribute to tobacco cessation among combustible tobacco, and that they're part of the solution, that they're innovating. How do we counter these narratives from the perspective of either the FCTC, civil society, governments? These are the narratives that are out there. So anyone that wants to quickly address it, maybe in a minute or two. Please, Jaime.
Yeah, as I mentioned, this is a new narrative. What you can say, the industry, for example, one example, they're saying we are trying to make new products less harmful to offer these products to people who smoke in order to quit, basically. And what you can see in countries like Colombia, where there is a total ban of cigarettes advertisement, is Marlboro, IQOS, Zyn, and all these products, beef, the e-cigarette, all these products from Philip Morris in the same space, in a festival, music festival with young people. They don't ask, hey, do you smoke? Do you want to quit? Do you want to try this thing in order to quit? No, they say, try this new product. This is cool. This is nice. So the industry must be pay attention to the laws in the country, but they don't care basically. That's one thing that I really want to highlight. And the civil society or the front groups supported by the industry, they don't care about also that. They don't care about quitting. They just care about promoting a new product. So this is a very important element that we need to consider. Even today, in countries where there is a total ban of tobacco advertisement, the industry continue advertising cigarettes and trying to introduce new products. This is an important element that I want to highlight.
Thank you. Ouleymatou, Les?
Just further to that, let's not forget that tobacco control is the best form of harm reduction, and we need to reframe this issue as tobacco control stakeholders. Secondly, we need to apply the effective measures we have for tobacco, such as the Empower measures, to the regulation of vaping products in countries that are allowing them. Heated nicotine products and other nicotine products that are not licensed for medical use.
And maybe quickly, just to jump in, I think from the research perspective, yes, the tobacco industries might come with different products, but there's little verification of whether these are also harmful or not. And there's no one who's really regulating the products, the different products that are coming in at a very fast pace. So there's this blind spot where, yes, different products are being introduced to the market, and no one is there to assess and also evaluate whether these products are very, very harmful, which of course they could be. And I think for tobacco industries, the other component that we should understand is that they want to stay in business. And as Jaime said, yes, they're introducing new products and really not really paying so much emphasis on quitting. So I think we have to be wide-eyed on the different products that these industries are bringing in, because I think much of what they do is just introducing different products to keep people hooked, and so they can maintain their profitability.
Thank you, Tina. And I would give Ouleymatou the chance for a last word.
Sure. Just to quickly come over the question about vapes and novel products, I really think that from the Afro perspective, the fact that these products have entered our market, we really cannot afford to repeat the same delays that we have with cigarettes in acting now for just overall equity, health, and just for our future generation.
I can't close it better than that. Thank you to all of our panelists and truly unmasking the appeal. There's so much that we can be doing, that we should be doing at the country level, civil society, at every level. And I want to point your attention to some links that I think will be dropped in the chat. I also think there might be a form to fill out to evaluate this webinar. And just thank everyone for coming here to attend this World No Tobacco Day seminar, Leaving No Country Behind. Thank you so much for attending.